As a healthcare assistant or as a healthcare support worker, part and parcel of our role is to support nurses and doctors and the whole team that we work with. And also, the whole point or the whole reason why we are in these jobs is to support our patients and their families to live life, a fulfilled life, and also to work effectively for the betterment of their health and their condition as well. So there are certain things that we need to do to avoid certain very detrimental or very serious mistakes in the job. And there are a few things that I thought, well, I'll share with all of you today so that we are just mindful of certain mistakes that people are making that can lead to maybe loss of life or disability, or even can land you in serious trouble, like ending up like being jailed or being deported or being sacked from a job. So I'm just going to be like making a quick rundown of some of the common mistakes that we need to avoid or pay attention to as healthcare in this job in this country. My name is Florence, and a big welcome to my YouTube channel. Thank you so much for hitting the subscribe button, because we share a lot of information on life in the diaspora, life in the UK, how to navigate certain opportunities and certain success pathways, especially for healthcare, especially for newbies in this country. So stay tuned on this channel and keep showing us love and likes in the comments. And if you have anything that you need us to share or to shed more light on based on our experiences, we are not experts, but we do share based on our experiences and what we feel we can benefit and also edify amongst each other as a community. So guys, let's get straight into it. So first and foremost, one of the things that I want to share with you that we need to be mindful of is confidentiality. There's a whole legislation about confidentiality, how to keep patient information confidential, organization information confidential. This is taken so seriously in this country because there's a whole legislation, the GDPR Act, Data Protection Act and GDPR. It's very taken seriously in this country. So sharing patient information with inappropriately and discussing cases outside of professional settings is a big no. This can be discussing it with colleagues outside work. This can be discussing it with colleagues in corridors. It's a big no. Only share information about patients, about clients on a need-to-know basis with the right people in the rightful setting. So talking about it in a car or in a supermarket is a very big no. Even sharing like documents, sharing pictures, maybe you've taken a picture of the notes and then you're sharing it through WhatsApp. It's a big no. There are channels in your organization, there are channels in your workplace of how to share images, how to share documents, even emails, even who you send to. It's very important. So be wary of what you do and how you do it. Sometimes even when you answer phone calls, you have to be very sure who you're talking to, and you have to be so sure if you are allowed to share certain information about a patient with that person in particular. So it's not just about saying, oh, it's their family you've called, so maybe I can tell them, oh, the results are back and they are this and this. You have to be so mindful of how you share information about a patient. Also, the other thing that I want to mention, the second thing I want to mention is inadequate infection control practices. Guys, hand hygiene and infection control is very important, very critical. Make sure you're following the proper hygiene protocols, such as hand washing, proper wearing of PPE, proper usage of personal protective clothing is very important, because you just never know. You could end up like cross-contaminating in between clients. You've moved from this client to the other, you still have got your mask on, or you move from your car with gloves on and you're going into a client's house. You just never know what you're bringing into that place, and if investigated and they realize like you were not following proper protocols, this can land you in trouble. So you need to be mindful of these things. You have to follow all infection control guidelines, including proper hand washing, wearing gloves and mask aprons when needed, and also adhering to sanitation protocols to prevent the spread of infections. So be very careful what you do. I'll talk about communication, how we communicate with patients and clients. Always keep it respectful. Always keep it very professional. Always keep it very compassionate as well. So Be an active listener when you're talking to patients, when you're talking to clients. Failing to listen to patients and not clearly communicating with your team can be deemed a serious offense or a serious mistake within the organizations that we work for. So always maintain clear and empathetic communication with the patients and colleagues as well. Be clear, be respectful towards your colleagues, towards the patients or the people that you're looking after. Also, clarify instructions when necessary and ensure patients have understood the procedures or the care instructions. Good communication is essential for patient safety and team coordination. Why do I say that? Like, we do work in multidisciplinary teams sometimes because it's not everybody who is English or who understands or speaks English that well. So it could be the people that you're looking after, or it could be within your team. So make sure you've understood the instructions, you've understood what you're supposed to do. Where you're not sure, always ask. I always say, better be known for asking than for doing the wrong thing and then you go like, oh, I didn't understand, because there's no excuse. Once you're told and you're going to do something, there will be no excuse like, oh, I didn't understand. Rather get clarity, rather get the instructions right. And also just learn to speak to others politely, kindly, in a professional manner. Always keep the language professional. One of the things, while we are on communication, the other thing that I want to mention is you could be in that team where you work and you're from the same country. Always use English in a professional setting. If I've seen settings where, because we are from the same country and then we just are complacent and we are speaking our own language, that's not being professional. That's not allowed in the workplace. So make sure you keep it professional. That's all I can say. Sometimes you could be saying, oh, it's just me and the colleague and the client. It's not like we're talking to them, but you are in their space, you are in a workspace, you are in a work environment. So it's quite important that you do respect them in that regard. Documentation. I cannot overemphasize on documentation, guys. The need for proper documentation. Forgetting to accurately document a patient's observations or care or incidents can be deemed very serious. So what is it that we're supposed to do? We always complete records timeously. While you're within that call, complete the notes for the client, because as you complete the notes or the checklist, that's when you realize, oh, I've forgotten to do that, and you do it. So never leave the setting or the house and then do the notes in your car. That's not allowed, guys. That's not allowed. Also be thorough and very factual in your documentation of observations. Vital signs, feeding, medication intake is critical for the patient safety and continuity of care. Professional boundaries. So many people have been caught off guard when it comes to this one, and no wonder why we are talking about it today. So always perform tasks that are within your job role. Perform the tasks that are meant for you. Do never ever do tasks that are outside your competence or job description, such as administering medication, taking bloods, or do not do that. If you're not competent, if you're not trained for that, do not do it. So you should always know your scope of practice. Healthcare have specific duties and clinical responsibilities, and you should leave competent staff for competent people. That's like for the doctors, for the nurses. So in as much as you would love to help, some of these nurses and doctors are your friends, but when it comes to work and for accountability's sake, do not do things that are outside your scope of work, that are outside your responsibility or your job role. Because if anything goes wrong, you are liable, you are accountable, you are responsible. So always remember that. And then we go to patient care. Offering inadequate patient care for whatever reason is a big no. So these examples of inadequate care, this is like where you rush through tasks or you're neglecting essential aspects of care, like tending bedbound patients or monitoring hydration and nutrition for whatever reason. I'll give an example. If you're in domiciliary care, maybe somebody has got 4 calls, and part and parcel of those 4 calls, because maybe they're bedbound or they're just in chair, if they are meant to be turned or repositioned on every call, please do so. It's very important. It's there for a reason for you to do that. If they're on a fluid balance chart, nutrition chart, always document they've drank so much, they're passing this much, they've eaten this much, this is what they've ate. Document. Take the time to deliver quality care. If it's 30 minutes call, if it's an hour call, it's an hour call for a reason. It's half an hour call for a reason. Take the time to do this. Don't just be rushing through, because sometimes that's when you realize, oh, somebody has not been changed pads since morning. They've had a Wattpad all day long. They end up with bed sores. They end up with, pressure sores because they have not been tended. So it's very, very important that we prioritize patient comfort and well-being in this job, because that's our responsibility. That's the reason why we are there in the first place. Reporting concerns. Sometimes, because of duty of care, if you see something that is concerning, it's your responsibility, it's your duty to report it, not to cover it up or not to just ignore it because of duty of care. So not reporting patient concerns or abnormalities in a timely manner is a grave mistake. So this could be a change in condition or safety issues where you're not saying, oh, I think this patient is being abused or is being neglected, or there's something going on with them that's not right. Please do report, and report it timelessly. So you can always report these concerns to a supervisor, be it a nurse, a doctor, or so such changes in a patient's condition can prevent complications or escalate concerns appropriately where it is necessary. Escalate it in an appropriate manner or to the rightful person, instead of saying, I didn't know, or I've been seeing it happening, but I thought somebody. You see it, report it. That's my take. That's how I do it. See it, report it. Consent, see it, report it, and report it factually. There's no need for you to lie or fabricate. Report it as it is, and then it will be investigated. If there's nothing, it's okay. If there's something, then somebody will do something about it, and you would have helped somebody along the way. Part and parcel of the things that I want to mention as well: time management. It's a 30-minute call. Be there on time. It's a 7 a.m. call. Be there on time. So poorly managing your time can lead to rushing through tasks, and at the end of the day will lead to mistakes along the way. So it's important that you prioritize your tasks and manage your time effectively, and so that you can ensuring that all patients receive the care that they need. And if you're overwhelmed, always ask for help, ask for reinforcement, ask for help from colleagues or your supervisor to say, yes, we've been going in that call for 15 minutes, but this person I think always needs extra. They're struggling with maybe mobility, or they're struggling with this and that, than for you then to be struggling in there, or to leave the patient and they're not helped because it's a 15-minute call and you need to go to the next person and you're not managing, or you feel, oh, I think their mobility needs have changed and I think maybe they need reassessed, maybe they now require 2 people to be helped. So it's very, very important that you're managing your time well. You are able to ask for help where you need it. Also, one of the things that I want to mention is our physical care techniques. These do come into play. I mean, what are we talking about? Incorrectly moving and handling patients can lead to injuries for you and for them as well. So it's quite important that we use proper moving and handling techniques. I've seen people come to me and say, Flo, a friend of mine reported us for doing this and this with this patient. We were asking them to do this. Moving and handling is very prioritized. If somebody is a hoist, they're a hoist. If they are a Zimmer frame, they're a Zimmer frame for some reason. So please make sure you are attending your training, you know what to do, and you know how to use these things, because some of these equipments, they're supposed to be used by 2 people. And that's for a reason. So always wait for the other person for you to operate certain equipment. Always ask somebody to say, oh, I need a hand with this, or can you come and help me? Just because if something happens while you're using that equipment, maybe somebody falls or anything, and then you're on your own. And then, so prioritize these things. Pay attention to these things, guys. Last but not least, some of the things that I want to talk about is failure to follow protocol. I'm big on policies, I'm big on procedures, to say each and every organization in this industry, in these jobs, has got their own policies and protocols. So not following these protocols, like fall prevention, medication checks, and emergency procedures, are gross mistakes. And so what is it that you need to do? You need to familiarize yourself with these policies and follow them. If you're unsure about any procedures, seek clarification from your supervisor. Don't do things that you're unsure of. Don't assume things. where you need an explanation, where you need clarity, always go to your supervisor, go to your manager and say, I'm not too sure about this. What is it that I need to? I'm not yet competent on this one. Can I have further training? That would be good. That would be good for you. Guys, before I end this one, I'll talk about lack of professionalism. Being unprofessional in behavior, appearance, and attitude. That is like, it's a gross mistake, and it's quite common. And this can involve like just being late or even inappropriate language towards colleagues, towards the clients that we work with. So be mindful of your behavior, be mindful of your gestures, be mindful of the language that you use with your colleagues and with the clients that we serve. Maintain a professional attitude at all times, be punctual, dress accordingly to the workplace guidelines, and treat everyone respectfully and in a dignified manner. Avoid inappropriate behavior, inappropriate language. Sometimes you could be saying, oh, they're my friend, I thought they would like it. You could end yourself in trouble because of your mouth. You could end yourself in trouble because of your behavior and attitude. So sometimes it could be your facial expressions can be interpreted a certain way. So what do I advise? I always say to people, always be smiling, be cheerful in the workplace. I mean, it's a place to spread joy and love. So always do this. So guys, before I end this, I'll just say, dress accordingly, be punctual, follow workplace guidelines, and treat everyone the same way that you would like to be treated. Speak to them in the same way that you would like to be treated. And by following these, by avoiding the mistakes that we've spoken about, you're not only protecting your career and reputation, but also you're ensuring a high standard of care for your patients, and also you are maintaining and forging strong focus on patient safety and personal, professional relationships with your colleagues, with the people that you work with, and their families. So I would say maintain a strong focus on patient safety, dignity, and professionalism, so that you're set apart for success as the healthcare assistant in this industry, in this country. And also this can give you the confidence and the competence to target for more advanced or for bigger roles and career progression going forward. Guys, that's all I had for today, and I'll see you in our next video. Don't forget to subscribe.